All right, so today we're diving into something that sounds straight out of science fiction, but it's real, folks. We're talking AI, artificial intelligence, and get this. It's being used to analyze people's faces to diagnose rare genetic diseases. Wild, right?
It is pretty mind-blowing, isn't it?
Yeah, it is, especially when you think about how tough it is to diagnose these rare diseases. Like, it can take years, right, for patients to finally get an answer.
Oh, absolutely. For many patients, it's a really long and frustrating road to diagnosis. They see doctor after doctor, go through countless tests. It's a real struggle.
And this is where this AI system called GestaltMatcher comes in.
Yeah.
And I love this, by the way, next generation phenotyping, or NGP. So it takes those facial features, combines it with genetic data, and boom, a potential diagnosis.
It's really remarkable.
So walk us through how it works. Like, how does this GestaltMatcher thing actually use facial analysis to figure out these diagnoses?
Well, think of it like kind of like a map, right?
Okay.
And this map is called the clinical face phenotype space. Each point on that map, right, it represents a unique combo of facial features. So the AI analyzes the patient's face, plots all these features on the map, and then it can start to see like clusters and patterns that match up with specific genetic conditions. It's able to do all this thanks to this massive database they have, the GestaltMatcher database, they call it, or GMDB for short. It's basically a huge training ground for the AI to learn and get better at, recognizing these subtle facial patterns and making those connections.
So it's almost like the AI is picking up on things that a doctor might miss with a naked eye.
Precisely. And it's really cool. The more data this AI has access to, the better it gets at making these diagnoses.
So it's all about that data.
It really is.
Now, I got to ask, are there any success stories with this GestaltMatcher thing, real people who've actually benefited from?
Oh, yeah, absolutely. There was this one case. It was a patient who had been searching for answers for years. I mean, years. They went through all sorts of tests, saw specialist after specialist, nothing. Nobody could figure out what was wrong. Right. And then they tried GestaltMatcher. And you know what? It analyzed the patient's face and their genetic data, and bam, it identified the syndrome. I mean, talk about life-changing, right? Because now this patient could finally get the right treatment, start managing their condition. Really incredible stuff.
That's amazing. It's like this AI is giving hope to people who've almost given up, right?
It really is.
So what kinds of rare diseases has GestaltMatcher been, particularly good at diagnosing so far?
Well, it's been showing a lot of promise, I'd say, in diagnosing certain types of craniofacial syndromes.
Yeah.
Those are conditions that affect like the head and face and have pretty distinct facial features. But researchers are also looking into its potential for diagnosing genetic disorders that affect other parts of the body, too. It's still early stages for those, but it's definitely an area of active research.
It's fascinating.
Yeah.
And it seems like the more data, the better, right? Especially from around the world.
Oh, absolutely. It's like anything with AI. The more diverse the data, the more accurate and reliable it becomes.
Makes sense. So what's the biggest roadblock to getting this global data sharing going?
Well, it's tricky, right? I mean, one of the biggest challenges is figuring out how to standardize the data collection across different countries. Everyone's got their own healthcare systems, their own ways of doing things. So getting everyone on the same page in terms of how they collect and share the data, that's a big hurdle.
Right.
Plus, you've got to think about all the privacy and security concerns around this kind of sensitive genetic information. We have to make sure that's all being handled responsibly. But, with the potential benefits here, people are really working hard to find solutions and make it happen.
Definitely worth the effort, I think. Now, this whole thing has me thinking about the future of medicine. Are we going to see AI taking over from human doctors when it comes to diagnosing rare diseases?
Well, it's a question that comes up a lot these days. But I think, instead of thinking about AI replacing doctors altogether, it's more about how these two can work together.
Like a partnership.
Exactly. Doctors have, years of training, experience, and most importantly, that human touch. They build relationships with their patients. They listen to their concerns. And then you have AI, which is amazing at analyzing huge amounts of data, seeing patterns that we might miss. It's really about combining the best of both worlds.
Yeah, that makes sense. I mean, you can't replace that human connection. So to kind of wrap things up here, this AI, this GestaltMatcher, it's shaking things up in the world of rare disease diagnosis. Analyzing facial features, combining that with genetic data, it's already helping people get answers, get the right treatments.
It's a powerful tool, that's for sure. And I think it has the potential to really revolutionize how we diagnose and treat these conditions.
And it's not just about facial features and genetics either, right? I mean, think
Uh,
about all the other medical data out there. Medical imaging, maybe even voice recordings. Who knows what the future holds for AI in medicine?
It's really exciting to think about, isn't it? Like, what other possibilities are just waiting to be discovered?
Definitely a lot to ponder. And hey, listeners, that's something for you to think about too. What other ways could AI be used to diagnose diseases? What breakthroughs are just around the corner? It's really an incredible time for medicine.
It really is.
All right, that's it for our deep dive today. Thanks for listening.
Thanks for having me.